Hello, and welcome everyone to the Early Childhood Health Consultation June webinar titled Sample Health Policy Template Workshop. We are so excited to have you join the conversation today. My name is Maria Morgan, and I'm working as the project manager with Early Childhood Health Consultation. Our team and program are in partnership with the Wisconsin Department of Children and Families, housed at the University of Wisconsin-Madison School of Human Ecology, and funded by the Preschool Development Grant. Our program's mission is centrally around Wisconsin early childhood education and helping support best health and safety practices. And we envision a sustainable and statewide model working through health expertise and health consultation in focusing on promoting health and safety practices and centrally focused on the health and well-being of children across Wisconsin. The Early Childhood Health Consultation Program acknowledges the American Indian tribal nations across Wisconsin and commits to a partnership to best meet the needs of each tribal community. The Early Childhood Health Consultation Program offers general guidance on best practices for health and well-being in early childhood settings. Any questions about a specific child should be directed to that child's primary care medical home. For today's workshop, we will kick it off with a few introductions, have central considerations around the sample health policy template, have opportunities for breakout small group exploration. We'll come back together as a large group for question and answer and have a few closing remarks. For those interested in Wisconsin Registry continuing education credit, stay tuned for the end of today's presentation. We will include a Qualtrics post-webinar survey link directly in the Zoom chat for you at the end of today's session. So for today's conversation, we have a few considerations and objectives. The first is looking at the importance of high-quality health policies in early childhood care settings, and specifically looking at a tool called Caring for Our Children, how it aligns these best practices. We're going to explore the sample health policy template as a tool and looking through the different components and how it can support Wisconsin early childhood care and education programs. We'll develop strategies for easily implementing this tool, and finally wrap up by identifying early childhood health consultation as a resource for your health and safety questions within early childhood care and education settings here in Wisconsin. So without further ado, I would love to pass it over to our program director, Dr. Dipesh Navsaria, as well as our registered nurse health consultant, Kelly O'Connor.
Thank you so much, Maria. Really appreciate it. And thanks, everyone, for being here today. We're excited to roll out this tool. So as you know, I'm the director of the Early Childhood Health Consultation Program, and I'm pleased to have our nurse consultant, Kelly O'Connor, spending some time with you today to talk about the sample health policy template. And I'll chime in periodically as we go through this, and we'll also have some adequate time for you all to practice and explore it in groups as well. Kelly, take it away.
Awesome. Thank you. Thank you, everyone, for joining us today. Thank you for the incredible work you do for the children of Wisconsin. We know it takes a very special person to work with young children, and we are really excited to be here with all of you today. So we already touched on this a little bit, but what are we talking about today? So in hopes of making your life a little bit easier, we created a health policy template so that formulating a health policy for your care center can be as easy for you as possible. In developing this health policy template, we used information from Caring for Our Children to ensure it's aligned with the best health and safety practices for early childhood. We also partnered with the Wisconsin Department of Children and Families to ensure that this policy is aligned with the Wisconsin licensing and certification. So you can feel confident that all the information in this policy is up to date with current recommendations. And on that note, I want to give a shout out to Caring for Our Children. In case anyone today isn't familiar with Caring for Our Children, it's a free online resource designed for early childhood educators. And it's a database with the most up-to-date information for everything you need for your employees and for your kiddos. It's a really great resource. So I highly recommend you take a peek if you haven't already. I also wanted to take a moment to shout out why having a health policy is important. When I think of health policy, I think of a very dusty document sitting in my drawer. But if we have a well-written and easy to use comprehensive health policy that's based in science, it can be an effective tool for you and your staff to ensure that your children and your employees are healthy and safe. So we can really kind of start to visualize using it as a tool as opposed to something that we have to do that's just kind of shoved in our drawer. But we get it. Creating a health policy can be very hard, especially if you're not a healthcare professional. Heck, it was really hard for us too. So the health policy template we're going through today was developed in partnership with DCF. And like I said, we use Caring for Our Children to make sure that all the information was the most recent up-to-date stuff. So some of the things that we discussed today might be different than what you're used to, but it could just be because it's an updated version of what you've had before for your health policies. So today's plan, we're going to go through how to use this template that we designed at ECHC. So first, we'll talk about how to navigate the template. And then second, we'll break out into small groups and play with the template and just kind of get used to it so that you can bring it back to your centers knowing how to use it. So there's many different sections in this template, including everything you need to have an all-encompassing health policy. So we're not going to spend a lot of time today, like really getting into the weeds of the policy and what it says. We're more just going to use this time to do an overview of how to use it and how to navigate it. And if you ever did have specific questions, of course, you could always reach out to us. So first, we'll talk about how to physically access the template. So first, you'll navigate to our website through a browser, echc@wisc.edu. And then next, you can kind of see at the top, it looks a little tiny right now, but under the resources tab, you can go to see where that yellow thing is, the resource library. You'll click there, and then it will bring you to this next page. You'll scroll all the way to the bottom, and you'll click on that blue bar, and then that will open a new page for you. And we can see that page on the next slide. So this will open another slideshow, which is like a toolkit on how to use the template. So by yourself later, when you're wanting to use this, you can really read through each slide. But for the purposes of today, you'll just scroll all the way to the bottom and click on that first yellow box, and that will open the template for you. One of the first pages you'll see is this health policy template instructions. So throughout the template, you'll see many different color-coded boxes. The first one I want to talk about is these gray boxes. On the online version, you can click on these gray boxes and fill out what's applicable to your center. So it could be your center's name or something specific that your center needs. It will make sense as you kind of read through the template. There's also these check boxes. So if you're using the online version, you can physically click on the box and kind of type in an X. There's not a way to click and make an easy check box. We're hoping to fix that in the future, but for now, you kind of have to get creative with how you get that to work online. And if you're using the printed version, you can just check the box if it's applicable to your education center. You'll see a lot of blue boxes, and those will go over specific items that you need for preparation purposes. So things like safe sleep, talking with families, and then anything in a green box, you can scroll all the way to the back of the template, and you will have a glossary there with definitions of words. And then sprinkling out throughout this policy template is hyperlinks to get to anything that might be relevant, whether it's a resource we used or an email link or a phone number. So here's an example of our first page. So you would just, if you were using this for your center, you would just click on the gray area, type in your facility's name, your address, etc. And then there's those hyperlinks at the top that will lead you to our email.
Kelly, before you go further, if we could go back a few slides and just slowly walk everyone back to how to find that, because I'm sure if anyone was trying to follow along, they might have gotten slightly lost there with the only 2 or 3 clicks, but it can take a moment. So if we go back one more slide there and then just gently, slowly walk people through how to get there, that'd be great.
Yeah, for sure. So you'll click on the, or first you'll have to open a separate web page from, like, you'll kind of have to navigate the browser outside of our webinar. Type in echc.wisc.edu, and then that purple, except those purple lines at the top, you'll hover over resource, and then you'll see that drop down box of resource library. Click on that. And then that will open the second page that you'll scroll all the way down, and you'll see that blue box at the bottom with the link. Anything to add to that?
Nope, just think people needed a slower second walkthrough in case they were getting lost along the way.
For sure. It's a lot. So next we're going to be kind of moving into our activity section. So we will break you out into small groups so you can play with and navigate different sections of the template. So each group will be assigned one of the sections from the table of contents. And the activity that you're being assigned is to literally just explore the section you're assigned. You don't have to fill it out or anything. You just have to navigate it, discuss with your small group what you like about it, what you don't like about it. If you have any questions, anything really that kind of inspires you to talk about it.
So Kelly, I'm setting up the breakout rooms right now. I do see there's a question about the slideshow. If, just want to highlight that while I'm busy trying to get these set up, that'd be great.
Oh, for sure. Let me see. What was the specific question? Oh, I can only get it to the slideshow. Oh, I see. So when you're at the slideshow, if it lets you scroll, it should let you scroll all the way down to, you might have to open the slideshow and then scroll to the last slide in that slideshow. And then that last slide will say full sample health policy template, and we'll have two options to click on. And the first one's the online version, and that's the one that we recommend that you click for today. It looks like there's a question about box 2. Maria, do you have any advice around box?
So when you click the link, it should be available and just open up as this view here. So once you go from the website and select that blue tile, it should just open up a profile like page of this PDF. You shouldn't need a box file.
Great. Now we can talk a little bit about what you'll do when you're broken out into your small groups. So first we'll go around and one by one introduce yourself, and you can throw in your favorite summertime activity. And then after that, we want you and your groups to dedicate 2 roles. So the first role will be a timekeeper. So someone to keep track of how much time you have left. Will be allotted about 15 minutes for these breakout sections. And then the next role will be a reporter. And this reporter will come, when we come back to a large group, we'll type in the chat what you talked about as a group. And I know that if no one wants to be the reporter, maybe you pick one by whoever's first name is first in the alphabetical order, if no one jumps up right away and says, I want to do it. And then when you're in your small groups, you'll see your section, or you'll see your group has been assigned a section of our template. So you will navigate using the template, you'll navigate to your section and just read through it and discuss together. You can navigate to the section or to the template using this link. And I believe we're going to put that in the chat for you when you break out into your small groups. Is that correct, Maria?
Yes,
that's correct.
Yeah, that is correct. Sorry for that. Let me just break in for one moment. I know people are having some challenges around Box. What I'm going to do is put the direct link in to the chat here. And I have double checked. Anyone that has this link should be able to get to the quick start manual. So folks might need to try that if they're getting a prompt that's telling them to go to Box. For all the folks who are saying that they are otherwise, occupied with, of course, childcare, we get it, it's the middle of your work days, or don't have a microphone, right? You also have the ability in the small groups to talk to each other via chat as well, as you best can. We know that there's many challenges tugging at your attention. So. Okay, I am not sure. It is set to allow anyone with that link to be able to see that publicly. Okay, but I'm seeing some people saying that the link worked for them.
And so maybe when you're in your small groups, if you're someone where the link isn't working for you, just say that up front. And hopefully each group has someone with the link that works. And then you can just be an active participant and listen to what people are saying and ask questions if you can't physically see it this time. And so as a group, whether you can physically see it or not, you'll just discuss it. So the people who physically can see it might kind of have to do a little describing or reading for the group if they're okay with that. And there's no need to fill out the template. We really just want you to get familiar with it. Come up with questions, things that you do and don't like about it, etc. And then if the timekeeper could keep track of time and let the group know when there's 5 minutes left and 1 minute left. And then our team will bring everyone back to this large discussion group together, and we'll have the person who was the reporter just give a brief summary of what your group discussed and answer any questions about what you all have.
Yep, and I see the comments. I know sometimes different levels of quality of internet service and so on might be challenging. Let me also, in a moment, let me see if I can just drop a link to the actual file here as well, to just see if that can help things here. Technology, it's always delightful. All right, I am going to just see if I can put this in. Oops, that doesn't help me. Okay. Yep, and we will work out what's going on with the box. I'm just trying to get a file shared out to you, which, why am I not seeing that? Maria, are you able to see the share file option in the chat?
I am not at this time, but happy to take a pause here and help behind the scenes.
Okay. Well, it seems like some folks are able to get in. So what we're going to do is move everyone into their breakout groups. So at least if some of you have access to things, you can at least start the conversations instead of enjoying the spectacle of us, trying to get the file shared to you appropriately. So we've randomly assigned you. This is the Zoom kind of just randomizing in and of yourself into different rooms. And I'll just tell you the room names are child inclusion and exclusion due to illness. That is one of the biggest single topics that's there. Staff inclusion and exclusion due to illness, hand washing, medical emergency, and then the last one is special healthcare needs. These are random assignments, but we really want you to just walk through and talk about what you have there and think about what are the ways you might use this, what are things that you might want to include, not include, and think about how this might help you hopefully have a better health policy constructed using this template in different ways. So I'm going to open all the rooms at this point, and you should get an invitation that is to enter those rooms. Okay, I see people slowly disappearing into the rooms. Thank you. That we'd like to know from your breakout rooms. So again, just what was your section topic or name? What were your key takeaways, and were there any questions that specifically came out of those items there? So if I could ask the reporters from each of the 5 groups to please paste in what they have, and we'll make some comments or observations as we see those go by there. And then we'll have a chance for addressing some specific questions and also any other questions that might have come up as you're going through that. So I'll just give people a few moments to get their observations pasted in there.
Dr. Navsaria, are you able to see in the chat the hand washing group's notes?
No, because if you pasted them while you were in the group, in the breakout room, they would have only been in the breakout room.
How about now?
Yes, I can see them now. Thank you. And I'll just kind of make some observations here. Thank you for pasting that in, and I'm sure other folks are working on getting their comments in here. And thank you. These are really, really helpful. Yes, a little wordy. We struggled with being complete while also not being too long. Yep, helpful as an orientation process, like the modifiability, DCF's involvement. Yes, we wanted to make sure people were not getting mixed messages from different folks. Yep, hand sanitizer guidance, great. Yeah, thank you. Those are all really helpful. We appreciate those observations that are there. Kelly, any thoughts from you about that one? You're muted, Kelly.
Thank you. No, I appreciate all these comments. These are really great. Should we start with the hand washing section?
Yes, just because that's the first one that got pasted in. So hence I'm looking at that.
Great. A little wordy. Yeah. Oh, that's a great idea about using a slideshow for staff trainings. It's a great idea.
Mm-hmm. Yeah, I think when you're onboarding new people, I think I've discovered in a lot of places, right, like having an easy way to kind of get people up to speed, especially if they're new to the childcare world, that can be a great resource. So
Totally.
not an intended use of the slideshow, but certainly one that I think that would be a great one.
Yeah. And I think this is a good example too about how a health policy can be used as a tool.
Mm-hmm. Yeah. Great. Was there something in particular about the hand sanitizer guidance that stood out? Feel free to unmute if you want to just comment on that.
I think that it was, we appreciated the amount of guidance that was in there, but we were surprised at how much attention as we roll back from the exceptions that were made during the heavy days of the pandemic, knowing that the allowance is really not there very often. There are very limited options, times that hand sanitizer is actually an option. So it surprised us, I think, to see so much of the hand washing template include language on sanitizing.
Yeah, yeah. Well, look at that again. You know, it's interesting because from a healthcare perspective, we're usually thinking of hand sanitizer as the um, faster, more likely to happen situation, right? And that the number of times you shouldn't be using hand sanitizer are some very specific scenarios around particular illnesses, or obviously if there's visible soiling. And again, in childcare, you're much more likely to see visible soiling, particularly if kids have been playing outside, or if there's a diapering accident or anything like that. So it may also be a matter of those contexts there. So great. Kelly, shall we move on to the next section of comments, which in the chat is the inclusion or exclusion criteria?
Yeah,
Dr. Navsaria, just real quick on the hand washing and the sanitizer, if you relook at that, then with that, as you were just stating, maybe even adding a header or an emphasis or a bold or something that indicates a reminder about the any visibly soiled hands should be, soap and running water.
Yes.
Because the information about the quantities and those kinds of things of the hand sanitizer and what was available, that was really helpful.
Yeah.
But I think that's where we felt like there might be a little mixed messaging, was when can you use the hand sanitizer and when must you wash with soap and water?
That is a great point, and we will look at that again and make sure that we are highlighting that. Thank you.
Yeah, that's helpful feedback. So let's see, the next posted was children inclusion and exclusion due to illness. This was a hefty section, so great job, y'all. Let's see, some of the feedback was layout is good. That's awesome to hear. Easy for families to understand, like the definition of severe ill appearance makes it clear to parents, empowers the provider when they know a child is sick. General exclusion criteria and routine exclusion criteria could confuse providers and families. I could see that for sure. The flow chart is difficult to read without zooming in. That's also great feedback. Yeah, this is another good example of how your health policy could be used as a tool. A kid has something going on and you don't know if you should recommend them going home or not. And all of this was based off of caring for our children. So you can feel really confident in this, that it's the most up-to-date information on when children should be included or excluded from care.
Yeah. It makes me think also that there may be some value. We can look again at the flow chart, but think about whether there's some value in maybe sectioning that out and making a larger version available for people who choose to use it. If you say, hey, I don't think this is useful or makes a difference, that's fine too.
Yeah.
Yeah. Mm-hmm. Yeah, and it's always I teach physician assistant students in a classroom setting about pediatrics, and the whole how ill is a child, that sort of general look. It's one of those things, right? I think we all know when we see it, but how do you define that in words can be such a challenge. So I'm always grateful when I see good examples of definitions that help guide us, because then they help us to do a better job of guiding others. All right, shall we move on to the next one on medical emergency?
Sounds good. Medical emergency form. They like the additional resources, was helpful, short, streamlined form. They like the specificness, especially like the debriefing aspect with staff after to make changes. That's great. Poison control number included, link to DCF, consent for care was there, along with other resources. Excited to explore more of these forms. No questions at this point. Great. I'm glad that section was helpful.
Yeah. Medical emergencies always strike me as one of these things where they're so important, and yet, thank goodness, we don't get many opportunities to get good at it, right? Because we don't want the emergencies happening in the first place if we can help it. So it's one of those things where I think really specific guidance can help in those situations. But if anyone is seeing emergencies on a regular basis, then it makes me wonder if you're offering childcare in an emergency room waiting area or not. So. Let's see, did the other two groups, the staff inclusion exclusion group, you may be typing or trying to paste in, or the special healthcare needs group, if you had any comments, we would appreciate seeing those as well. And I recognize people may be trying to pull those together as I speak. Yep. I see special healthcare needs, good information, all covered. Yep. Safety for the child. Yeah. Yeah. So much of children with special healthcare needs, I think, is doing that upfront work of asking for guidance, care plans, etc., from their healthcare team. You know, there is no way anyone can, even something as quote unquote straightforward as asthma. I have no way of knowing just by looking at a kid, you know, from across the room that, oh, this is the type of asthma that they need or don't need, you know, in terms of medications or care. It's so individualized. And I think empowering all of you to say, hey, I need a written care plan, right? This is important. I'll just say one of my other clinical duties is as a summer camp physician, and I'm getting ready to start that gig in a couple of weeks that I've been doing for years annually. And it's hard when you're looking at a kid and you're saying, wait a minute, where's your care plan? I can't just, I can do my best guess, but come on, you have a known condition that there should be a care plan. Makes a big difference. Informative, helped up, yep, okay. Staff exclusion, yeah, that's more straightforward. How is that list put together? Yeah, so this is all from Caring for Our Children. And I think they went on the basis of common illnesses that adults would have that would affect their ability to care for children, or that might infect children or create issues for them. And as they went through, Caring for Our Children has been around for actually quite some time. So as they went through revisions, I think they got feedback about questions that came up that they should have some guidance on or not have some guidance on, and so on. At the end of the day, there's only so many things that are common in the United States that that need to be covered. So eventually they get there in different ways. Mm-hmm. I'm seeing a question here about fever. In the beginning, it says fever of 100.4. And then the fever section says 101 for infants 2 months and older. Kelly, do you want to field that?
Yeah, and correct me if I'm wrong, but I believe that the fever threshold based on age is important for those really, really tiny kiddos. So that's why we see that discrepancy there, because in that first 2 months of life, there's a little bit more sensitivity than when children are older. Would you agree with that?
Completely agree. And I'm just looking at that section of the template here to just make sure that we got that absolutely correctly, as number of times we go through this, and then sometimes you find something here. Oh, yes. So I see under, is that under, I assume you're talking about the routine exclusion criteria. Yes, so it's fever with behavior change. The with is important there, right? So usually we're saying 101 for 2 months or older, but in that one, it's fever of 100.4 with behavior change. So versus a kid who might have a slightly elevated temperature and there's not much else going on. That's the difference there that you're seeing. The other words matter. When taking the temp under the arm, why do we add a degree? And the answer is we should not be adding a degree. Whatever the number is on the thermometer is what you take. There was some old kind of thinking that the temperature under the arm reflected, not the same level of temperature that it truly is, and we should be adding a degree. The science on that is absolutely terrible. And we've seen all sorts of issues come up with that. So do not add a degree, do not subtract a degree, just simply say what it is on the thermometer. And whether it's 101 or 102 is, medically speaking, not a huge difference. However, I have had situations where I had one in clinic, their child had a 99.3, which is actually part of the range of normal. And somebody added a degree and said, see, it's 100.3, and sent them in for us to see them. They had no other symptoms. They didn't even really have a fever. It was all sort of manufactured thanks to adding that degree. It was an unnecessary exclusion and an unnecessary visit. So it was an opportunity for education of both the parents and the center as well. All right, we are almost out of time. Kelly, I'll let you take it away on the last few slides there.
Great. So just wanted to take a moment that we get it. There's a lot of stuff in this policy template. We are looking into creating an easy to use Wizard online version. If you don't know what Wizard is, don't worry about it, but we're hoping within, no promises, but sometime in the future, having an even easier to use version of this. And if you're trying to use this for your early childhood education center and you're having issues opening it, filling it out, whatever it may be, we want to hear about those challenges. So please reach out to us if that arises for you. We want this to be as easy to use as possible and as helpful as possible. We also just want to give a shout out to our resources, Caring for Our Children, DCF, and our own internal resources. And then I will hand it over for our closing.
So as we wrap up our time together, we would like to just say a few closing remarks. The Early Childhood Health Consultation is here for you. We offer on-demand resource library found on our website, such as what we explored today with the sample health policy template. We also offer monthly webinar training, such as this workshop, and tailored health consultation to target locations across Wisconsin. We are currently supporting over 300 active early childhood providers across Wisconsin with aims to have a statewide implementation of our health consultation services. We also invite you to join us for our podcast. It is Teachers, Toddlers, and Tissues, where the sticky, icky world of early childhood meets health. Our episode 4 is planned to launch next Wednesday, so please feel free to subscribe and listen in using your favorite platform. There's various ways to reach us. We'll be dropping this contact information directly in the chat, phone call, text, email, our contact form on our website, as well as social media. We'd like to take a special thanks to the many early childhood care and education providers, including our very own advisory board who help us best meet the needs of programs and the children they serve, our colleagues of other childcare health consultation programs across the United States, current project partners, past project team members, and including here, our reference material of Caring for Our Children. So as we wrap up our time together, in the chat, you can access our post-webinar Qualtrics survey link. This is a great place for you to offer us feedback in ways we can improve future webinars, as well as enter your information if you would like continuing education credit with the Wisconsin Registry. Following the event, you can expect a follow-up email with a link to the webinar recording, as well as a copy of the Qualtrics survey link, just in case it's needed. Then a few weeks after the event, you can expect that any information entered for the Wisconsin Registry will be directly entered with the registry for attendance purposes. And then a webinar recording will be made available on our YouTube channel, as well as our website. Please save the date for next month's webinar. Feel free to check out our website for upcoming events. And again, I'd love to draw your attention to the chat where you can access the post-webinar survey. So I will pass it over to Dr. Navsaria for closing remarks.
Thank you so much, everyone. And thank you again for these wonderful comments. This was a lot of work for our team, and it's great to see that it's resonating for some people. Again, this is completely optional, but we hope it makes it easier for you to write good health policies and be able to make a difference out there. Thanks for the work that you folks do every single day for children and families in Wisconsin. It's greatly appreciated. Thank you and take care.